My name is Jordan Miller, and this is my microbiology case study. Next slide. Patient information, we have a 29-year-old female who is of 17 weeks gestation. She is located in Oregon. She has no previous complications through the first 16 weeks of her pregnancy. She presents to the ER with fever, flu-like symptoms, abdominal pain, back pain, and a stiff neck. Preliminary thoughts on patient presentation. It's suspected when she's in the ER that she could have influenza, a UTI, pancreatitis, dehydration, or a GI infection. The initial lab tests ordered by the ER physician are a CBC with differential, a CMP, amylase, lipase, and CRP, influenza A and B testing, COVID testing, a biofire GI panel, and a urinalysis. During initial lab findings, the CBC shows an elevated white count of 18.8, mild anemia, hemoglobin of 10.2, could be due to the pregnancy, no cause for concern there. Neutrophilia of 91.5% neutrophils with a left shift. This would indicate a bacterial infection. We're also showing lymphopenia at 4.4% lymphocytes. Influenza A and B testing is negative, ruling out flu. COVID-19 testing is also negative, ruling out COVID. Chemistry findings show an elevated CRP, showing systemic inflammation. Amylase and lipase are within normal limits, ruling out pancreatitis. And biofire GI panel results were also negative. Urinalysis is within normal limits. The patient was admitted to the hospital for further observation. A CMP and a CBC were ordered for morning draws. 2 sets of blood cultures were also ordered. One was drawn from her left antecubital and one was drawn from her right antecubital, showing good coverage if there is a bacterial infection present. Between 12 and 13 hours of incubation, all 4 blood culture bottles become positive. Each bottle is gram stained and plated to a blood, chocolate, MAC, and anaerobic plate. Gram stain shows each bottle is positive with gram-positive rods. The laboratory workup on the blood cultures, growth was observed on blood, chocolate, and the anaerobic plate of all 4 bottles. This is showing that the organism is a facultative anaerobe. It's also ruling out contamination by Corynebacterium. Whenever you see a gram-positive rod in blood cultures, you think Corynea, but since all 4 cultures are positive, this is showing there's probably a true infection going on. Beta hemolysis is observed on the blood agar plate. Catalase is positive, bile echelon is positive, and we also have growth at 4 degrees Celsius. We also show umbrella pattern and tumbling motility observed at 25 degrees Celsius. The organism identified is Listeria monocytogenes, and the disease that is being caused is listeriosis. This shows concern for both the mother and the baby, as Listeria is one of the bacterial pathogens that can cross the placenta. Treatment, patient is started on IV antibiotics, ampicillin and gentamicin are used. Listeria from our class notes grows at low temperatures. Cold enrichment grows at 4 degrees Celsius. Processed deli meats can contain Listeria. Listeriosis, the neonatal fatality rate is 50%. There is an increased risk for pregnant women, and it can cause spontaneous abortion and stillbirth. It is a gram-positive rod. The colonies resemble Strep agalactiae, small beta colonies on blood agar plate, and sometimes the hemolysis is hidden under the colonies. Listeria's biochemical tests are catalase positive and bile echelon positive. Motility at 25 degrees Celsius with an umbrella pattern, and tumbling motility. The catalase and the gram stain are what separate Listeria from group B strep in this case workup. How was she exposed? She was exposed during the 2025 Listeria outbreak linked to pre-made pasta dishes that were sold at Walmart, Kroger, Trader Joe's, and other grocery stores. The clinical importance of Listeria, refrigerated food items are of great risk for contamination by Listeria monocytogenes. Incidences of listeriosis associated with pregnancy are 13 times higher than the general population, and Listeria is one of the few foodborne pathogens that can cross the placenta. Outcome and conclusion: the mother recovered with the use of antibiotics. Despite initiation of appropriate antibiotics, fatal loss occurred due to listeriosis. As of October 30th, 2025, 27 people infected with the outbreak strain of Listeria have been reported from 18 states. Of the 26 people with information available, 25 have been hospitalized and 6 deaths have occurred. 1 death from each of the following states: Hawaii, Michigan, Illinois, Oregon, Texas, and Utah, with 1 pregnancy-associated fetal loss. There's my works cited. It seemed like I slowed down. Same time.